Hey everybody, this is... And we at St. John's have embarked on producing a series of oncology safety training videos in order to increase safety in working around hazardous materials. The reason why we are doing this added training is because it's important to keep in mind that if one worker fails to follow safe handling procedures around hazardous materials, that can place many other employees at risk for exposure. After viewing these safety videos, staff are invited to critically examine their work practices in order to identify activities that might result in exposure and to change practices that might put them and their colleagues at risk. Once you are aware of the latest safety guidelines, if you notice others working around hazardous materials in an unsafe manner, let them know how they can best protect themselves and others who might come after them. By us learning how to best look after ourselves and coworkers, it sets a standard for all. Great caution should be taken when handling hazardous drugs in order to prevent spills. Spills can occur at any stage through the preparation and administration process. However, some spills are inevitable. For example, if urine, stool, or emesis is on the floor, that is to be treated as a chemo spill. The first thing to do when coming upon a hazardous spill is to assess the size of the spill. If it can't be cleaned or absorbed with one spill kit, then it should be considered a code orange hazmat and a spill team will conduct the cleanup. If you're not an oncology nurse, do not attempt to clean the spill. Instead, it is your responsibility to keep people away from the spill to prevent any additional exposure or tracking of hazardous materials. Notify the charge nurse, who will then find a chemo nurse to clean the spill. For our chemo nurses, you'll find spill kits available wherever hazardous drugs are stored. Inside the spill kit, you'll find the alert card. Place the alert card near the spill to warn others. Also inside the spill kit, you'll find the following items: a disposable elastic cuffed chemo gown with back enclosure. Chemo gowns have a lining tested to be impenetrable for toxic fluids. It is more effective than an isolation gown or a cloth gown at preventing chemo exposure. It should only be worn one time and discarded in the appropriate waste container. You'll also find 2 shoe covers, 2 pairs of chemotherapy gloves, an N95 respirator mask, chemical wash goggles, a scoop and a scraper, 2 chemotherapy absorber pads, 3 biohazard chemotherapy waste bags, and the hazardous waste sign. Don protective clothing: gown, mask, goggles, shoe covers, and 2 pairs of gloves, making sure the first pair is under the elastic cuffs of the gown and the second pair is over the gown. If you have long hair, it should be contained with a hairnet so it can't dangle into the spill. Bring the yellow RCRA waste container on the trolley to the outside of the patient's room. And then bring the yellow chemotherapy waste bags from your spill kit to the area just outside of the spill parameter. Now you're safely protected and you can proceed to the next step: cleaning the spill. Using the chemotherapy absorber pads, unfold them and allow it to fall flat over the spill. Using the scoop set, carefully remove saturated absorber pads and place them into the yellow chemo waste bag. Use the scoop and scraper to pick excess debris off the floor and discard into the yellow waste bag. After liquid and debris have been picked up, wipe area with spill towels. Now that you're done cleaning the spill, here's the best way to dispose of PPE. Begin to remove protective clothing. Remove the outer gloves one at a time, turning them carefully inside out to avoid touching the outside, which is considered contaminated. Next, remove the face shield. Grab from the back of the face shield, careful not to touch the front, which may be contaminated. Now remove the gown. Careful to pull it away from the body, not pulling it over the head to avoid transfer of contamination from clothes to skin. Turn the gown inside out, fold it tightly, and discard it into the yellow chemo waste bag. Next, remove the respirator mask, avoiding touching the front as well. Put the respirator mask into the yellow chemo waste bag. Tie the yellow chemo waste bag using a single loop knot to prevent aerosolization. Discard the hairnet and the second pair of gloves into the second yellow chemo waste bag. Step on the slide top yellow chemo waste bin on the trolley to dispose of your chemo waste bags. Wash your hands well with soap and water for 20 seconds. Following the initial cleanup of the spill, contact the Environmental Services Department for a terminal cleaning. Finally, complete an incident report by filling out a Datex form. And from there, you're done.